The single-arm phase 2 SATURN trial evaluates the efficacy of combining dual androgen receptor pathway inhibitors and metastasis-directed stereotactic body radiotherapy with intermittent androgen deprivation therapy to reduce recurrent rates in men with oligorecurrent metastatic prostate cancer. To do this, they assessed 28 men with recurrent prostate cancer after radical prostatectomy and 1 to 5 extrapelvic metastases detected on PSMA PET-CT. Patients received 6 months of androgen annihilation therapy, which included either leuprolide, abiraterone acetate plus prednisone, or apalutamide. Metastasis-directed stereotactic body radiotherapy was administered to all metastatic sites. The primary endpoint was to assess the percentage of patients with a PSA value of 0.05 or less 6 months after testosterone recovery. Overall, median age was 71 years with a baseline PSA of 2.6 nanograms per milliliter. Most patients had 2 or more lesions. 93% of patients completed the treatment, with 6 patients discontinuing at least 1 RP due to adverse events. Regarding the primary endpoint, 6 months after testosterone recovery, 50% of patients maintained a PSA level of less than 0.05 nanograms per milliliter. The median progression-free survival was 19 months, and the progression-free survival rate at 2 years was 36%. Regarding toxicity, 21% of patients experienced a grade 2 toxicity and 21% experienced a grade 3 toxicity directly linked to androgen annihilation therapy. On the other hand, SBRT caused grade 2 toxicity in 7.7% of patients, with no grade 3 toxicities reported. To conclude, the combination of short-course androgen annihilation therapy with PSMA-guided metastasis-directed therapy is effective in maintaining low PSA levels after testosterone recovery in half of patients. The treatment was well tolerated, with a 2-year progression-free survival of approximately 40% and manageable toxicity levels. However, the study's limitations include a modest sample size, significant heterogeneity in the patient population, no independent central reading of PSMA PET-CT scans, and the non-randomized design of trial. Further research should focus on identifying who should receive therapy, the optimal regimen to combine with metastasis-directed SBRT, evaluating long-term outcomes, and understanding the biological differences between PSMA PET-CT defined targets and conventional imaging defined targets.